Congratulations! Whether it's your first baby or your latest, it's exciting. Now, there's a lot to do, a lot to think about, not only for your baby, but for you too.
First, be sure to continue to have your teeth and gums examined and your teeth cleaned. Now, it's up to you to brush and floss thoroughly at least once a day. Use fluorides, eat a balanced diet, and continue to see your dentist regularly. Now that we've got you covered, let's talk about your baby. Now, don't worry, I'm not going to give you an endless list of things that only a saint could possibly remember. What your dentist and I want is to tell you what to look for and how to go about ensuring that you help your child get off to a good start with his or her dental health. Now, all anyone can ask is that you try your best. And remember, your dentist is there to help and support you.
Now you're a mother. That means you want the best for your child. You can't help it, but sometimes what's best for your child isn't always what's easiest to do or is most convenient. Take putting your baby down for a nap or to bed for the night. It's tempting to apply honey or sugar to a pacifier and leave the room. So, count to 5 and stop before you do it. Your baby doesn't need to get into the sugar habit, even if you need the peace and quiet. In fact, this practice can actually lead to the destruction of your baby's teeth. Or maybe you'll put a bottle of milk, formula, juice, or other sweet liquid in the crib with your baby. Again, it's easy, but it isn't what's best for your baby. Only water should be used in a nap time or nighttime bottle.
If you live in an area that has no fluoridated drinking water, be sure to ask your dentist about fluoride supplements for you and your baby. Fluoride can help your child's teeth become stronger and resist decay. Now, if daily fluoride supplements are prescribed, your child should use them until age 13.
Usually about 5 to 9 months after birth, your baby's first teeth will begin to appear. The appearance of these first teeth may be accompanied by drooling and a chewing action that relieves the discomfort in the baby's gums. Your dentist or pediatrician can recommend a variety of remedies to relieve discomfort. It's important to clean your infant's gums with a soft, damp cloth and to begin brushing these teeth as soon as they appear. You can even make a game out of it. In fact, as your baby grows into a toddler, continue to encourage brushing and flossing by letting him or her follow a child's natural instinct to mimic your actions. As soon as your child shows this interest, give him or her a toothbrush. It's sort of a status symbol, something that your child now has that adults also have. You should follow up your child's efforts with a more complete brushing of your own. By the age of 4 or 5, your child may have the ability to brush properly all by himself. Even so, you should continue to check to make sure that your child brushes thoroughly. Daily flossing is another habit you should start in your child. You'll have to floss for your child until he or she is about 8, but it's worth the effort. Flossing and brushing loosens and removes plaque, which is the #1 contributor to tooth decay and gum disease. Getting your child into the habit of a good dental hygiene routine will pay off his or her whole life. Once your child begins to eat solid food, the real test of your patience begins. If there is one general rule you should follow, it's this. It's not how much sugar you eat, but how often you eat it, how long it stays in your mouth, and when you eat it. For example, eating a candy bar subjects teeth to about 20 minutes of acid activity. Continued or frequently repeated consumption of foods that contain simple sugars prolongs the acid attack beyond 20 minutes. This extended exposure of teeth to acid can contribute to tooth decay. Besides laying down the law on brushing and flossing thoroughly each day, checking on the use of fluorides, and having your child see your dentist regularly, try to monitor your child's diet and limit snacks. Choose sensible snacks such as cheese and vegetables. Try to avoid snacking on fruits which contain sugar. Don't leave candy dishes out and try to use sugarless gum.
Since this isn't a perfect world, your child is going to eat sweets. All you can do is try to have your child eat these as part of a meal, not as snacks. As if you didn't have enough to remember, there's still one more major dental event that your child should experience early on, his or her first visit to the dentist.
You can make it easier for your child to face this unfamiliar experience by making an adventure out of it. You can talk about some of the things your child will see, like the lights and the water and the chair, and how the dentist will count your child's teeth. Your dentist's first visit procedure will vary according to individual preference, personality, and your child's needs. What's important is for you to be supportive and allow the experience to unfold for your child. As in every other aspect of your child's early development, you make the difference. It's you who will make all of these incredible learning experiences positive. The excitement and care that you feel before your baby is born should carry on through your child's early years. It won't always be easy, and it won't always be fun, but it will be worth the effort in the long run.